Okay, let's unpack this. Today, we're diving into something genuinely crucial for your long-term well-being. We're talking about diabetes blood tests. Our mission really is to shed light on why these tests matter so much for you. What good they do, and also how easy it can be to find them locally, say in a place like Chippenham.
Right. And what's interesting is how just knowing about a simple test, especially when you can get close to home, like in your own community, how that helps you stay on top of your health. It sort of begs the question, doesn't it? How can we use this local info, these local resources, to really look after ourselves and maybe avoid bigger health scares down the road?
Absolutely. And a lot of this great insight comes from an article over at Blood Test UK. It's called Diabetes Blood Test in Chippenham, Your Local Guide. And it's just packed with useful bits about how the tests work and really what they do for you, how they empower you. So let's break it down. What is a diabetes blood test, basically? In simple terms, it's a quick check of your blood sugar levels, your glucose levels,
Exactly.
to see if they're maybe too high.
And the core benefit here, the reason they're so important, is finding out if you might have diabetes early on, or even pre-diabetes.
Right.
And if you do have it, these tests are key to managing it well. Knowing your numbers helps stop those, potential bad problems later.
Like heart trouble.
Yeah, exactly. Heart trouble, kidney issues, nerve damage, things that can happen if blood sugar stays high for too long. And what's often missed is that there isn't just one test, right?
Oh.
You got, say, the fasting plasma glucose test. That's like a snapshot after you haven't eaten overnight,
Just one moment in time.
pretty much. But then there's the A1C test, and that tells a really different, quite crucial story. It shows your average blood sugar over the last 2 or 3 months.
3 months. How does it do that?
Well, it measures something called glycosylated hemoglobin. Basically, how much sugar has stuck to your red blood cells over time. So it's much more stable, less jumpy than a single reading. It's not thrown off by, like, what you had for breakfast.
I see. So that A1C is really useful for diagnosis and for checking how well management is going.
Absolutely. It gives that longer-term view. Catching high levels early with these tests can genuinely change your health path.
And this connects to daily life too, right? Because maybe you don't feel any symptoms.
That's a huge point. Many people are at risk and have no idea. Of course, there are risk factors like being over 45 or having family history, but sometimes the signs are subtle, like always being thirsty, needing to wee more often, feeling tired for no reason.
Those could be little alarm bells.
They could be. And preparing for the test. Usually pretty simple.
Just fasting for some of them.
Often, yeah. Just not eating for a bit beforehand. That ensures the results are accurate. Gives you and your doctor the clearest possible picture.
And the local angle you mentioned, that's key for making it easy for people.
Totally. Take Chippenham again.
Oh.
You got places like the Chippenham Medical Center, Devices Road Surgery, St. Mary's Surgery.
Regular NHS clinics.
Right. Plus private options like Nuffield Health. There's a whole network. It means getting this vital information isn't some abstract idea. It's literally available just down the road for many people.
Puts the power right in your hands, really. Makes taking that step feel much more doable.
Exactly. It shows the real benefit of having health resources right there in your community.
So let's wrap this up. What's the main takeaway for you listening?
Getting a diabetes blood test. It's a really smart move, a good investment in your future health. It helps you catch potential problems like pre-diabetes or diabetes super early. And that gives you a chance, a window to make changes, maybe diet, exercise, sometimes medication, changes that can genuinely boost your quality of life and stop those serious complications we talked about. And knowing where to go locally, like in Chippenham, just removes a big barrier. Yeah, and if you think bigger picture, these tests are really about you taking charge, gaining foresight. It's about having specific, actionable knowledge, knowing your numbers, so you can make informed choices before things become serious problems. It's like having an early warning system for your body.
A map to better health.
Exactly. A map starting right where you live, in your community. That gives you a real sense of control, agency over your own well-being.
Great point. And remember, you can find more really helpful local guides like the Chippenham one we mentioned from Blood Test UK. So a final thought to leave you with, what's one small proactive health step you could take this week? Maybe using a local resource near you just to check in and understand your body's amazing work a little better.